I'm Dr. Tammy Bailey-Stanton, and we are presenting this evening for the Rahima Musa Mother and Child ED. It's my great pleasure to invite Dr. Amina Dar to present. Dr. Dar worked at Rahima Musa Hospital in the emergency department for many years. She also worked for a very long time in the Department of Obstetrics, and she did a presentation for us a couple years ago on medico-legal documentation, which was excellent. And I would like everybody to have the opportunity to hear it, which is why I've asked her to do the talk for us. I'm going to ask her to introduce herself, and then after that, Dr. Dar, it's totally fine for you to turn your video off if you would like to do that.
Thank you.
Yeah, okay.
Thank you.
So welcome. Thank you.
Thank you, Dr. Stanton. Good evening, colleagues. I'm Dr. Dar from Occupational Health and Safety, Rahima Musa Hospital. Okay. So, Tammy requested me to talk about medico-legal documentation. I just want to say one thing. I just wrote, if you didn't document it, you didn't do it. That's the main thing you must keep in your mind. Second thing is, keep in mind, whatever we write in the file, it becomes an official document or record. Medical Protection Organization says that good quality medical records are an essential component of safe and effective healthcare. Failure to document relevant data itself renders a significant breach and deviation from the standard of care. Then correct and thorough patient records, either in electronic or handwritten format, are important for the continuity of the patient care, and it improved patient safety and outcomes. And also it protects doctors against a complaint or clinical or medical negligence claims. They provide information about clinical scenario of the patient at that time and support management decisions. So what are the medical records? Next slide, please. According to the Health Professional Council of South Africa, medical records are any relevant record made by a healthcare practitioner at the time of or subsequent to a consultation and or examination or the application of health management. And keep it in mind, doctors are obligated by the Health Professional Council of South Africa to keep suitable medical records. The National Healthcare Act number 61 of 2003 and Health Professional Act number 56 of 1974. These two acts are prescriptive in respective of health records. You can check on their websites. Then medical records, next slide, please. There are a few examples of medical records. Medical record includes a range of documents related to patient care according to HPCSA. These are handwritten concurrent notes taken by the healthcare practitioner, notes taken by previous practitioners, including patient discharge summaries. For example, in the file, previous doctor diagnose a patient with hypertension, or on discharge summary, it's written cesarean section due to APH. These are medical legal documents. So when you write the discharge summaries, you must write it clearly. And when you write your notes, you must mention previous practitioner diagnosis was what. Then the other thing is referral letters to and from other healthcare practitioner. For example, if you refer the patient to any subspecialty or specialty or the specialist or to the consultant, document it. For example, you are referring the patient to orthopedics for the further management, you must write in your notes. Or the referral letter you are giving to the patient also should be written in a very clear way. If patient comes to you with the referral letter, also write it down in your notes. The patient was referred by GP so-and-so, or patient was referred by the pediatric department to us. You must mention these things. Then it comes to the laboratory reports and other laboratory evidence, such as histology, for example, polyp sent for histology, cytology slides, for example, pap smears, and printouts from automated analyzer. For example, you are doing blood gas in ED, X-ray films and reports, ECG traces, and CT reports. All should be mentioned. That patient was sent for CT report came, and it was also mentioned that who reported that CT report. Then audio-visual records, if you have, such as photographs, any videos, or tape recordings, those are also medical legal records, medical legal documentations. Then another thing is clinical research forms and clinical trial data. Any forms you fill, that's also a medical legal forms. Other forms you complete during your consultation, for example, as an insurance form, disability assessment, and documentation of injury on duty. And also sick note, that's also a medical documents. Sick note, which is very important. Usually, maybe we write every day few sick notes. Please write it down carefully. If patient doesn't want to disclose the diagnosis, you mustn't disclose the diagnosis on the sick note. Then it comes to the death certificates and autopsy reports. Those are also medical legal certificates. And one more thing is, if there is any infectious diseases, any communicable diseases, for example, TB, you report to the infectious department or to the district health. You must write it down that patient was diagnosed with TB and reported to the district health. Most common cause you see in ED or in your practice is the dog bite. It's very important to report the dog bite. That's also, that forms are a medical legal. Then there are some good tips. Next slide, please. There are some good tips for medical records. Next slide, please, Tammy. Yes, that one. These things I learned from my experience also. Always include date, time, signature with full name. First write your full name and then signature. Or if you have a stamp, stamp on your notes. So these are your notes. Do not change them. Once you write a note, do not change them by crossing something out. If you make a mistake, add an amendment instead of crossing the first line. It seems like maybe you fiddle with your notes later on. Any correction must be clearly shown as an alteration. Complete with the date the change was made and your name or signature. If you made it if you corrected it just at that time, write the same date and time. Then other thing is documentation. Documentation all decision made. Document all decision made. Any discussion with the patient or with your senior. All the information given by the patient or to the patient. Document it. Relevant history, you must document it. Clinical findings, you must document. Patient progress, you must write it down. Investigations, you must record. Results, you must record. Any consent taken, you must record. Any referral given, you must record. I just want to say one thing. Never rush while making the notes. I know most of you are working maybe in ED, but even if you're working in ED, take your time and write the notes unless there is any emergency any recess, then you can leave your notes, attend that emergency, come back and write down the notes at the same time. You can't leave the notes for the next day. You will forget everything next day. If not everything, at least 50% you will forget next day. Then it comes, another thing is, please don't write any offensive or unnecessary comments. For example, racist, sexist, or ageist remarks. Sometimes we say that Somalian, old Somalian, ugly woman. Please don't write it down. Or rude patient, don't write it down. That if anyone is rude with you, that's another separate incident you have to report, not in your notes. Only include relevant things that are relevant to the health record. Another important thing is please avoid abbreviation unless standardized. Means anyone can easily understand. For example, if you write PID, all the doctors or medical practitioners, they knows that what PID means. ICA, DKA, UTI, but not the other person. If you are writing these things on J88 form, which we will discuss later on, please don't use abbreviation on those forms. I can give you an example. When I started this ED, one day sister called me, doctor, please come, there is a case of SA. I said, what is SA? Sister, what is SA? So she said, sexual assault. So my point is, never use abbreviation if it's not very obvious. Then document patient histories. Important thing is to record any allergies or any known comorbid. For example, hypertensive, diabetic. For example, you can say any other things. Allergy, why I'm saying, for example, patient comes to you with a dog bite. Now you have to prescribe antibiotic, and one should know about the sensitivity to penicillin. It should be recorded. Patient is not penicillin sensitive, or if penicillin sensitive, what you are going to give. You have to document that also. Then it comes to the that's important thing is, another important thing is notes are of particular importance in medical legal cases. For example, if it's a motor vehicle accident, pedestrian vehicle accident, involvement in a fight, alleged assault, rape cases, dog bite, assault in pregnancy, abandoned child. In the case of the minor, mention who accompanied the child. For example, father, mother, grandmother, aunt, or the neighbor. Make short notes about the incident also. That's also important. Very short and precise notes, but about the incident. How it happened. For example, if the mother or father says that a car hit the child, you have to ask whether the child was at the roadside, was in a parking area, running or trying to cross the street. The time of the incident is also important to document. Inquire about the presence of witness and ask what happened afterwards. For example, loss of consciousness, vomiting, fits. All of these provide valuable medical information and assist in the treatment. And also later on, it will help in filing medical legal forms, filling the medical legal form. In case of PVA, pedestrian vehicle accident, mention whether the driver accompanied the patient to the hospital or not. It might be a hit and run case, which is a crime. And document in your file, the driver was accompanying the patient or patient came alone. In case of a motor vehicle accident, ask whether the patient was sitting front or the back seat, whether a seat belt was worn or not, and note it down, please. In case of physical assault, ask what the patient was assaulted with. For example, stick, fist, kicking, strangulation, lashes, slap, and whether the assault was by a known or unknown person. These are all, you have to document all these things. In case of rape or suspected rape, Inquire about whether the patient showered, washed her genitalia, washed her or his genitalia, or changed their clothes. Write it down, everything. If you didn't write, it means you didn't do it. You can't prove later on, I did it, but you didn't write it. Always mention it if a language barrier exists. A lot of foreign patient comes in Rahima Musa hospitals. Always write if there is a language barrier and mention the name of the person or healthcare worker who translates or interpret for you. Better to ask that person's sister or ENA or even the attendant to write their name and sign in the file. And next slide, please, Demi. Then it comes to the examination notes. After you took the history, then examination notes. Even if you're working in a very busy place, general condition of the patient you must mention. In case of PVA or MVA, assess the level of consciousness. Mental or emotional status is also important. For example, patient is crying while describing the assault. Condition of the clothing, torn, blood-stained, or there is a mud or dust on the clothes. For example, patient says to you, I was walking to home and 3 or 4 people grabbed me, took me to the grass field, and they assaulted me sexually or physically. You have to look at and patient says, I came straight to the hospital. You have to look at the patient. If she's wearing clean clothes, there is no dust on that, you must mention it. Patient stated that, but my findings are this. Next thing is also assessment of the vital signs are also very important. It should be in your file. It should be in your notes. General physical examination, relevant systemic examination, as well as a thorough regional examination must be included in your notes. Thorough examination and documentation is essential in the case of MVA, PVA, assault, whether sexual or whether physical. And while explaining the injuries, describe the location, shape, extent in centimeter size, surface, associated bleeding. It is a good idea to include a diagram. As you can see there, we are not asking or demanding a fine art work, just to make a diagnosis, just to make a diagram which you can explain later on, or you can use that diagram to explain your findings on the legal documentations. Do not miss any fracture and internal injuries. Write it down. Mention both positive and negative finding. For example, you have to write in case of MVA, PVA, whatever, no signs of internal bleeding, no signs of fractures, or no signs of appendicitis. Whatever score you are using for that, if you have a time, you can mention that, but at least write it down. No signs of acute abdomen. Positive and negative findings, both are important. Then it comes to the management notes. Next slide, please. Management, you all know, include investigation, treatment, and follow-up. Their results, investigations, the results should be written also. In the case of a consultation with an expert, for example, orthopedic surgeon, neurosurgeon, ENT, obs and gynae, pediatrics, mention the date, time, name, and contact number of the consultant and write it down their expert opinion. Write it down, was it a telephonic consult or physical consult? Dr. So-and-so came to the ED or came to ward so-and-so to see my patient, and she made her own notes. You can write it down. Or she asked me to write the consultation, whatever they are saying to you, but you must write it down. clearly write down the management plan and mention that this was explained to the patient and parents in case of minor. Lots of patients are complaining about the doctors, they didn't explain to me. And doctor says, no, I did. If you didn't, be truthful. It's better to take 1 minute and explain to the patient. Mention investigation ordered or conducted along with available results. For example, you ordered in case of head injury, you ordered CT, you ordered X-ray. In case of MV or PVA, you ordered ultrasound. Also write it down, who did it? Ultrasound done by you in ED or ultrasound done by sonographer or radiologist. Even mention who reported on CT or X-ray. The other thing comes, then write down the treatment given. Patient comes to the ED, you must write it down. If it's a dog bite, laceration, cuts, anything, that ATT given, anti-rabies, tetanus toxoid given, antibiotics given, back slap given, pressure bandages to apply to control the bleeding, or suturing done to control the bleeding. Any analgesia you gave, you must write it down. Fluids or bloods, if you gave that one, you must write it down. Fluids, normal saline, plasma light, or Voluven, whatever you use, you must write it, and how much fluids were given to that patient. Then write down the follow-up plan and date. For example, you want to refer this patient to orthopedic OPD. Patient is stable for discharge, and follow-up should be done in orthopedic OPD or gynae OPD or ENT OPD or neurosurgery OPD. You must write it down, follow up, explain to the patient. Then also discuss medico-legal option to the patient. To open a case and ask them to come on a day when you are on duty. Keep the file in your locker. Take a picture of your notes and keep a record of the patient's name and number. As all of you know, in South Africa, doctors are routinely expected to complete J88 form in cases of medico-legal significance. And most of the time, J88 is not readily available, and patient usually comes without J88 form. Later on, they open the case with the police and then they come with the J88 form. So if you have notes, then it will be easy for you to fill that J88. In case of a child, a social worker might need to be involved for the safety of the child. Social worker has to assess the safety of the environment, especially if there is a non-accidental injury suspected. Write it down. Social worker was called. She said she will be available tomorrow, and she advised to admit the patient in ward so and so, ward 2. I'm going to see this child tomorrow. Don't just discuss and not to write. Then usually we fill form 22. I'm sure most of you know what is form 22. Reporting any abuse or deliberate neglect of the child, and statement to the police, and a J88 form. These are the common forms we fill. Sick note we fill. So now I'm going to, just if you will see on the slide, there is a medico-legal form you can see which you need to be filled, J88. How to fill J88 form? It's very easy. Don't be afraid. Any clinician, any medical practitioner who sees the patient first has to fill the J88 form. If patient comes straight to gynae ops, pregnant lady with an assault, and you are working in gynae and ops, and you saw that patient, you can't say go back to the ED. ED doctor must fill the J88 form. No, you have to see the patient You have to see the patient and later on you have to fill the J88 form. It's not only ED doctor's duty. All practitioners, even GPs, if they sees the patient first, they have to fill the J88 form. So this is the first thing. To fill the J88 form, take time. Don't fill in rush. If you are in a rush, you can keep the form with you and say, I'll fill it tomorrow. Because you can't cancel your findings and changing the wording. Take your time and use black pen. Blue ink fade. That's why legal documents, they demand black ink. Write whatever you write legibly. If you write clearly, court will never call you. Hardly, maybe 1% chance the court is going to call you to come and for your that. Basically, they call you because they can't read your writing. They can't read your writing. So always write neatly. The second thing is avoid medical terminology on J88 form. Court call you just to explain that terminology because they don't know what is the abrasion. It's better when you describe a bruise, mention the region, size and color. For a laceration, mention there is a cut. What is the length of that cut and what is the depth of that cut? Instead of saying abrasion, say scratches. Simple language used on these medical forms. Linear red marks, possibly from a belt. Then, in case of a slap or someone being pushed where they complain of pain somewhere, but there is no tenderness on examination, nor there is any clinical evidence of physical trauma, still assault cannot be excluded. Please remember this thing. If someone slapped, doesn't matter that there should be a mark of 5 fingers on the face. If you can't see that marks, it doesn't mean that patient was not assaulted. Mention in that case also, when you fill the J88 form, mention positive and negative findings also. Write concluding remarks. There is, for example, there is an evidence of physical trauma. Or you can write, even in the absence of any visible marks, physical trauma cannot be excluded. Then these diagrams, you can see, you can mark your lacerations on right side of the scalp, temporal area, next to the nasal bridge, or to the lip of the corner. So, or on the left side, right side of the body, you must mark on that one and explain on this paper. Each and every paper should be signed, or if you have your stamp, you should stamp that form. Then it comes to my last point is, in case of subpoena, we are very scared from subpoena. Oh, I don't want to go to the court. Subpoena means court order, or it means to appear in court. When it comes to you, the officer who brings that subpoena to you, ask that officer, please send me a copy of my J88 form. So before appearing in court, read your notes carefully and prepare yourself in advance what they are going to ask. Another thing is, you can ask the police officer to provide transport for you. And in case of female doctors, you can demand a female officer to accompany you. These are few points you have to keep in your mind. Please, my last thing is, always remember, good medical notes are important, not only because it is our duty as a medical practitioner. It is better for patient outcomes, and it also helps and protects us doctors. Make it a habit to write down thorough and correct notes. But also there is another point I want to raise. In ED, we all know our priority is the red patient, isn't it? For those patients, when we write our notes, we have to take time. But when we are not busy, sometimes we see the green patient, most of them comes with the flu. In these cases, you have to write short and precise notes. You can't spend half an hour on writing flu notes. This saves your time. So at the end, I just want to say, I have an exercise for you if you guys can write. There is a scenario I'm giving you. A lady came in ED carrying 5-year-old boy allegedly hit by a car. So he fell on the ground and now he can't stand and he is bleeding from the left leg. This is the scenario I'm giving you. So you all have to sit whenever you have a time, write your notes, history, first history, what you are going to ask, examination, your management, including investigation, treatment, follow-up, and how you are going to fill the J88 form. Thank you very much. Thanks for listening.
Thank you very much, Dr. Dar. We really appreciate that you've